Hello friends, problem based question related to the respiratory system. Let's check it out. A PFT is being performed on a 60-year-old man. Following data was obtained: tidal volume 500 ml, respiratory rate 15 breaths per minute, PeCO2, that is expired air PCO2, is 20 mm of Hg, and PaCO2, that is arterial PCO2, is 40 mm of Hg. And the question is, calculate the alveolar ventilation from the given data. Now, I have not given options because unless you know this entire thing about how to make this calculation, it will be worthless giving the options. So straight away, let's find out how you solve such questions. Let's start with the basics. What is being asked? Alveolar ventilation per minute. So what's it? What is alveolar ventilation per minute? Look, in each breath, we inspire the air, which is called as tidal volume. Let's say, let's take the arbitrary figures. We inspire 500 ml in each breath. Out of that, some of the air will be wasted in the dead space. So let's assume that 150 ml is wasted in the dead space, and what reaches the alveoli actually is the remaining one, that is 350 ml. So 350 ml is reaching the alveoli and taking part in ventilation with each breath. And if we take 10 or 15 such breaths per minute, then we can calculate alveolar ventilation per minute. That is how much air is ventilating the alveoli every minute. And the formula for that obviously would be tidal volume minus the dead space volume. Obviously, minus the dead space volume, so that the remaining air is reaching the alveoli, into the respiratory rate. That gives us the alveolar ventilation per minute. Well, now they have given tidal volume, already given in the data, and respiratory rate is given, but what was not mentioned? Dead space volume was not mentioned, and that means we need to calculate dead space volume first, and that's where the real crux of the MCQ lies. How do you calculate the dead space volume from the given data? It is by Bohr equation. What is Bohr equation? This is the Bohr equation, and this you must know in order to solve the MCQ. Vd upon Vt, Vd, that is dead space volume, upon Vt, that is tidal volume. So this ratio of Vd upon Vt is equal to 1 minus PeCO2 upon PaCO2. I've already mentioned it. This is expired air PCO2 upon arterial blood PCO2. This equation is to be used. Well, now it will be easy for you to just put the data and calculate. But let's understand what's with this ratio. What is the importance of this ratio? How do we know dead space volume from this particular ratio? Let's understand this, and then the things will be very easy. This is a diagrammatic representation. Let's say deoxygenated blood has come into the lungs. It is carrying carbon dioxide. Now this is the pulmonary blood. Carbon dioxide will diffuse from the blood into the alveoli, and then it will be expired out. Not all of the carbon dioxide in the blood is coming into the alveolus and getting expired out. So let's say carbon dioxide was diffusing from these alveoli, and then it was expelled out with expired air. Remaining carbon dioxide, what did not diffuse, has gone to the left side of the heart, left ventricle, and from there it will go to the arterial side. Okay, so we have two things now. One is expired CO2 and its partial pressure, so we are calling it PeCO2, partial pressure of CO2 in the expired air, PeCO2, and the other one is CO2 in the arterial blood and its partial pressure, so PaCO2. We have these two things. How do we know about the dead space from this particular ratio. Let's assume for a moment that let's say these two alveoli are not functioning, they are not taking part in the gas exchange. So that becomes a dead space, all right? And that means only these two alveoli are where the CO2 is diffusing into these two alveoli, and the CO2 is coming out in the expired air. Because of the dead space volume, because of the dead space, whatever is coming in the expired air is a less carbon dioxide, and relatively more carbon dioxide is reaching the arterial side. Why is this happening? Because of the dead space. Because of the dead space which is not taking part in the gaseous exchange, less carbon dioxide is coming in the expired air, and more, because remaining is the remaining carbon dioxide which is going to the arterial side. So it is more carbon dioxide, greater amount, which is going to the arterial side because of the dead space volume. So this is the logic behind calculation of dead space from the ratio PeCO2 upon PaCO2. I mean, if the volume of dead space is greater, then what will happen? Less amount of carbon dioxide will come in the expired air, and more will go to the arterial side, because it could not come into the expired air. It will go to the left side of the heart, and from there to the arterial side. So if this ratio, it is this ratio which is telling you the story about the dead space volume. If you find that in this ratio expired PCO2 has become less and arterial PCO2 has become more, that means there is a greater volume of the dead space. So that's the logic behind the Bohr equation, and taking PeCO2 and PaCO2 into the equation to understand the dead space volume. Now it will be very easy. We have PeCO2 20 and PaCO2 40 mm of Hg in the given data. Let's put the values into the equation. Vd upon Vt, the ratio of dead space volume to tidal volume. So Vd upon 500 was the tidal volume, is equal to 1 minus 20 upon 40. 20 upon 40 is half. So 1 minus half, that is 1 by 2. And now taking this tidal volume to the other side of the equation to calculate the dead space volume, it will be Vd is equal to 500 into 1 upon 2, and that is 250 ml. So finally we have calculated the dead space volume based on PeCO2 and PaCO2. Once we have calculated the dead space volume, then the matters are very easy. Alveolar ventilation per minute is equal to tidal volume minus the dead space volume into the respiratory rate. So it will be 500 minus 250 into 15, that is 250 into 15, and that is 3750 ml per minute. That's the alveolar ventilation calculated from the given data. We put up lots of such interesting and challenging MCQs and questions on our YouTube channel. Have you yet subscribed to the channel? No? Go ahead and subscribe now.